with Dr. Chris Dressel. And it's amazing, I think, today the technology that has developed in helping people with spinal problems that, never existed before. I guess people what were they relegated to? Just old-fashioned traction or something?
Well, yeah, the initial treatment when chiropractic first became a profession was all hands-on adjustments, manipulation, whatever you want to call it. Throughout the years, technology has evolved, and we're to the point now where we have computers that can actually analyze the spine and correct the areas that need to be corrected without using any of the actual hands-on, heavy twisting, cracking, popping forces that people sometimes don't care for.
Right, that's amazing. This is called the Pro Adjuster. And Dr. Chris, just tell us once more, what does this do?
What this machine does, first and foremost, is it can detect the exact areas of the spine where the joints of the spine are not moving the way they're supposed to. Okay. Then what it can do is actually go over that exact spot, and we can dial in the exact amount of force we want to use relative to both patient size and the location of the area to determine how much force we need to actually get motion throughout that area of the spine. It's very comfortable. Most patients really tend to prefer it over the more aggressive hands-on approach.
Let's just press a few here, and let's just see what this does. I want people to hear this because I have some. That's establishing a baseline, right?
Yeah. Then the computer gives us the readout here, tells us exactly where we need to adjust. Essentially, yep. So here it says the upper part of the cervical spine here needs to be adjusted. We go and we grab a certain amount of force, and we go right back to the spot that needs to be adjusted based on the screen here.
Okay.
All right, then we go in. It's a very light tapping sound.
And folks, when the tapping stops, that means the Pro Adjuster has achieved what you have told it to on the computer.
We're trying to establish motion throughout the spine, and once it feels that the area of the spine has given and that area is relaxed, it shuts itself off automatically.
And my friends, I'll tell you right now, that is not electric shock. So many people think that's electric shock going in there, and it's not.
No, it's just a small percussive force, a little tapping, that's all.
That's incredible. Is this used a lot on athletes?
We use this for athletes, we use this for anyone from 80-year-olds, 90-year-olds to, teenagers. It doesn't matter.
That's great. Pro Adjuster is not the only thing they use here at Chiro First. You do some decompressing. Can we go take a look at that?
All right, let's go.
Dr. Chris, what determines the amount of pressure used in decompression here?
Each patient needs a very specific level of decompression. Certain patients who are a little bit larger require more force. Patients that have a more serious condition, we don't want to pull them too much too soon. Okay, so we usually take into account, we start usually on a low end where patients will feel a very, very gentle stretch, if anything at all. Many times we do have patients even kind of fall asleep on the table, so they're so comfortable. Okay, so we will increase the weight during the summer.
Well, that's great. That's good to know. I wondered what you did to, as a precaution, to keep from, over decompressing or not doing enough. Now, someone that requires decompression, do they also require the Pro Adjuster and vice versa?
Well, the Pro Adjuster is great for addressing the back aspect of the spine, the joints of the spine.